Hi, I'm Professor Khalid Khan. I'm based at the University of Granada in Spain, and today we will talk about usefulness of randomized clinical trials. To discuss this topic, I have with me my friend and colleague, Dr. Janneke. Janneke, can you please introduce yourself?
Thank you, Khalid. My name is Janneke van 't Hooft. I'm a consultant gynecologist at Amsterdam UMC, and I'm also an epidemiologist.
Thank you. What paper are we going to discuss today, Janneke?
The paper we are going to discuss is called Assessing the Usefulness of Randomized Trials in Obstetrics and Gynecology, and we will focus today on the preterm birth trials.
Okay, so what is preterm birth?
So a pregnant woman can deliver either term, meaning at a gestational age of 37 to 42 weeks. But if she delivered before that time, she delivered preterm. And the babies um, that are born preterm are also having a long time on the NICU or long-term outcomes that are affecting their lives.
Okay, so when we have such a serious condition, how can we address this problem to deal with it in the future in the healthcare system through research?
So there are plenty of interventions that are proposed for pregnant women to prevent preterm birth. And to evaluate if those interventions are effective, you need a reliable trial to do so. And those trials are randomized controlled trials.
Can you explain a bit as to what they are?
So, a randomized clinical trial, you ask women to participate and you randomize them to either a new intervention or a standard intervention, and you assess those women to the same outcomes and see if there's a difference between those outcomes.
Okay, so this way we have a possibility to discover whether new treatments are better. However, I presume not all trials are made equal. What limitations can we face in studies?
So we face many issues, part of them methodological issues. We will not talk about them today. Part also fraudulent issues, and we will also not consider them today because what we would like to discuss today is the trials who are not fraudulent, but are having real data. How useful are they, and how transparent are they to change our clinical practice?
So, how many trials are there?
In preterm birth, there's a reaching number of trials and they are increasing, which is a good sign, but you will not have anything with an increase in the number of trials if they're not useful.
Okay, so how can we assess usefulness?
So we propose, together with a research group of Stanford in the US, a checklist, and that is seen here. It's a 8-item checklist with in total 13 um, assessment issues. And in these items, you assess the usefulness of trials.
So, when you apply this checklist to the problem of prematurity or preterm birth, what do you find?
So we assessed almost 350 trials in preterm birth, and we found that most of those trials are coming from North America, Europe, but also a increasing number of trials are coming from Asia. And looking at those items, we found that only 1/10 of those trials meet half of the usefulness items evaluated.
So, the majority of what is published um, has no hope of being useful to make any difference to the outcome of mothers and babies in the future.
Well, you could state that, but you could also state that we have found issues we can improve. And if we summarize the issues we can improve, there are some easy fix issues like
Mhm.
patient centeredness. So that means including patients in the outcomes that should be assessed in a trial. Those are in the core outcome sets. Also, including patients in the research agenda. Another issue is pragmatism, that if you design a trial, you can design it in such a way that it's a pragmatic trial representing common practice. And then there are issues considered to the outcome used and the power calculation. So we found that many trialists are using surrogate outcomes or a composite outcomes, which are problematic. So changing outcomes and having also a trial that is transparent by pre-registration of a protocol and sharing data, we can improve usefulness of clinical trials.
So, is there any hope for the future?
So we see, especially in transparency, that there is an improvement in time. In this bar, you can see that all the trials were scoring less in the usefulness criteria as the younger trials, the ones published after 2010, have much more usefulness criteria, especially the transparency one. So yes, there's hope. Researchers are improving the usefulness of clinical trials, but I think we can do better. So I hope we will do so because our research is only worth it if it really changes clinical practice. So reducing research waste is one main goal we should have as researcher.
Is this a problem unique to preterm birth, Janneke?
Well, we have studied this for preterm birth trials, but also for life intervention trials and also for pediatric trials, and we see similar findings. So it seems not to be the same. Um, it seems to be similar to other research fields, and therefore the conclusion remains that we should improve these items to increase usefulness in research.
So, really, researchers should be looking at the usefulness of their completed trial at the time they begin to design their study.
Yes, it is too late to evaluate usefulness when the trial is done. So I would really recommend researchers to think about their design and how to improve their design to increase the usefulness of their study.
Okay, Janneke, thank you very much.
You're welcome.